This lecture on hormone replacement therapy is presented by Dr. Frank Schallenberger. Dr. Schallenberger is licensed both as a medical doctor and a homeopathic medical doctor, and is board certified in anti-aging medicine. He has been practicing medicine since 1973 and has been prescribing natural hormone replacement to thousands of patients since 1991. He is author of 2 popular books on alternative medicine, which are available at all the major book outlets, and is also the editor of the Real Cures newsletter. Dr. Schallenberger is the medical director of the Nevada Center of Alternative and Anti-Aging Medicine in Carson City, Nevada. The lecture was recorded on June 20th, 2009.
Hello, I'm Dr. Schallenberger, and I want to thank you for tuning in today to learn more about hormone replacement therapy. Of all the things that we can do to keep ourselves healthy and young and vibrant as we get older, there are very little that is more powerful than replacing your hormones as they become deficient. I can think of exercise. Probably the premier way to stay young and healthy as you get older would be exercise. Regular aerobic and regular anaerobic exercise. Tune in, because we'll have another video up that will go into the benefits of exercise and actually give you some ideas on how to do that. Also, the other thing that is incredibly important for keeping you young and vibrant as you get older is your diet and what you eat. And then finally, right up with that group is replacing your hormones as they become deficient. So I know that there's a lot of misunderstanding and controversy around that, and so that's why I'm presenting this lecture to you, to teach you a little bit about what I've learned and what I know about hormone replacement therapy. So let's just look at the first slide here, and this is the big take-home message. If you only remember one thing from what I'm about to talk to you about, this is the message I want you to remember. Although replacing deficient hormones will make you feel better, that is not the most important reason to replace them. The most important reason why you need to replace your hormones as they become deficient is because through the process of remodeling, hormones will keep your body young and functional. So let me say it again. Although replacing deficient hormones will make you feel better, that is not the most important reason to replace them. The most important reason why you need to replace your hormones as they become deficient is because through the process of remodeling, hormones will keep your body young and functional as you get older. So let me discuss this process of remodeling and tell you about this absolutely marvelous way that God has created in our bodies to keep our bodies young and functional. Let me start by telling you, I had a guy that's 84 years old that came into my clinic the other day, and we did some metabolic testing on him. And this man, although he's 84 years old, actually tested out with the same level of mitochondrial efficiency and functioning as a man many, many years younger. And also, when we tested his cardiac output, that is the strength of his heart, how well his heart works, that tested out to be along the lines of a 40-year-old man. So he asked me, how can I, an 84-year-old man, with a heart that's been beating 60 to 80 times a minute, year in, year out, for over 8 decades, how can my heart still be functioning like a young man's? I don't understand that. You'd think it'd wear out. And my answer to him is, you know what? It's not, that heart of yours is not 84 years old. That heart of yours is about 3 years old. Because through the process of remodeling, you have been continuously replacing your heart cells. So it's not the same heart. It's a new heart. So I want you to remember this process of remodeling, because this is just critical. Think of this. Suppose you're 20 years old and you buy a brand new house. And then every day when you leave to go out and do whatever it is you're going to do, a group of workmen come in and tear down a section of that house. Say maybe one day they tear down a section of the hallway, another day they tear down the guest bathroom, and so forth. But each day they tear down a section of the house and then they rebuild it before you get back home again. So it looks the same when you come back in. And they do this every day of your life. Now flash forward to when you're 80 years old. That house is basically 60 years old at this point, but in essence, it's a brand new house because it's been continually remodeled. And that's what our bodies do. That's the way our bodies have been created to behave, to continually remodel themselves. So that every day of our lives, we go through 2 periods, each 12 hours long roughly. 1, we go through an anabolic period, and 2, we go through a catabolic period. The catabolic period is characterized by tearing the body's tissues down. So in that period, your muscles, your bones, your heart, your liver, your skin, every part of your body, with the one exception of the nervous system cells, every part of your body gets torn down just a little bit. And then in the anabolic period, in the other 12 hours of that day, all of that damage gets completely repaired. All of those cells that have been eliminated get completely replaced with brand new cells. This process of remodeling goes on every day of your life and continues to work functionally and fully well as long as you have these hormones. Because these hormones that we're talking about are the ones that orchestrate the process of remodeling. So you might just reflect a little bit, when you're 25 years old, when you're 35 years old and you're just loaded up with hormones and you go to injure yourself, how long does it take you to repair that damage? Now compare that to what happens to an 80-year-old person when they have a similar damage. It takes them much, much, much longer because the 80-year-old person doesn't have the hormones that are required to do the remodeling process nearly as well as the young man. So that's the big take-home message I want you to get from this lecture. And that is that although taking hormones does make you feel better, there's no question about it, that's not the important reason to take hormones. The most important reason to take hormones is because it'll keep your body young and fully functioning as you get older. Through this process of remodeling, your body will be continually renewed day in and day out, even as you get into your 60s, your 70s, your 80s, and your 90s. Okay, let's take... now this right here, this slide is going to talk about... Well, actually, it's just describing what we're going to talk about in this lecture. So the first thing we're going to address is the myths about hormone replacement. And then we're going to talk about the reality about hormone replacement. And then we're going to talk about what the hormones that are so commonly, what are the hormones we're talking about, and then what is the difference between hormones and drugs that have hormone-like effects. That's a huge difference. Also, what are the symptoms of hormone deficiencies? How do you know if you have one? And then what are the diseases of hormone deficiencies? And how are hormone deficiencies diagnosed? How are the hormone deficiencies treated? And do I have to take these hormones for the rest of my life? So that's what we're going to be talking about in the remainder of this lecture. First of all, myths about hormone replacement. Number one myth that I usually hear is, well, this is just for women. And that's absolutely ridiculous when you stop and think about it. When you stop and think about this process of remodeling I just talked about, of course it's not just for women. It's for women and men. Now, it's true, women's hormones go south a lot earlier than men's. Rather dramatically, when women hit menopause, their hormones go from a very high level to a very low level. Men's hormones take that dive too, but our hormones just don't take the dive as dramatically as that. Our hormones will go down, but over in a more slow way, and it's not as easily recognized. And we'll talk about male hormone deficiencies, however, and so you can know how to recognize them. But replacing sagging hormone levels is certainly nothing that you just do for women. It's something that men want to do every bit as much. Second myth is that it's only for symptoms. Now, I kind of touched on that just a moment ago when I talked about the process of remodeling. One of the things that many doctors and many patients alike continue to think is that you take hormones to alleviate hot flashes, or you take hormones to alleviate joint stiffness or aches, or you take hormones to alleviate depression and anxiety, or all those symptoms that you get, and we'll talk about these, all those symptoms that you get as you get older and your hormone levels start sagging, that you take hormones to make those symptoms better. And it's true, they'll do that. However, it's not just about symptoms. Remember, through the process of remodeling, Hormones are what keep you young and functional. So it's not just about feeling better, it's also about being better, being more functional as you get older. The third myth that I hear a lot is it's only for a short time. You're just going to take the hormones until you kind of get through the menopause, or take the hormones until you, I don't know, you get to some level, and then you can stop them. Now, that on the face absolutely makes no sense at all, because if you just believe what I told you, that hormones cause you to remodel, hormones improve the quality of your life, why in the world would you want to stop them? It turns around that I think this myth is propagated by the fact that a lot of patients, and doctors alike incidentally, mistake hormones from drugs that have hormone-like effects. And because they do that, and drugs are dangerous and have many side effects, a lot of doctors and patients alike think, you know what, these drugs are dangerous, therefore hormones must be dangerous, and so as soon as I don't, quote, need them anymore, I'll stop taking them. Well, no, that's not true. Hormones are for life. Hormone deficiencies are for life. As you get older, your hormone levels are not going to go up. They're going to do one thing, and that is to go down. And the only thing that you can do to offset that is to just replace them as they go down. So it's not just for a short time, it's for the rest of your life. And then finally, we'll deal with the issue of safety. One of the things that I hear all the time is, well, hormones are dangerous on you, aren't they? You hear this on the talk shows, you see this on lay media, and I want you to know that in terms of safety, there has not been one study ever published of any kind, in any way, shape, or form, that says that hormone replacement therapy is unsafe in any way. In fact, I would submit to you that if there's anything that's unsafe, it's to not replace hormones as they become deficient. And we'll talk a little bit more about this safety issue. Okay, next up, we're going to talk about the reality about hormone replacement. So those are some of the myths. What's the reality? Well, next to exercise and diet, replacing deficient hormones is the most effective way to slow down the aging process and prevent all of the diseases of aging. In fact, as I just alluded to, it's dangerous not to take hormones if your body needs them. Think about this. When are you at your strongest? When are you at your best? When you're young. When your hormone level's the highest. When you're young. When do you get sick? When does your body break down? When do you get diseases? As you become older. When your hormone levels start to sag? As you become older. So the reality is that replacing your hormones will make your body act more as it acted when you were young, which means that you'll be healthier, you'll function better than you do as you get older and don't have those hormones available to you. So, second reality about hormone replacement. Replacing deficient hormones is just as safe as replacing deficient vitamins. If your body is short on a vitamin, it needs that to function well. So you give your body the vitamin. Why? The vitamin is a natural thing. It's naturally in your body. And so you just replace what you're not getting. If your body is 100 milligrams shy of a vitamin, you give it 100 milligrams. You'd be foolish not to. The same is true for hormones. So I want you to think of hormones as what they are. They're a natural constituent of your body. We can do blood tests on your hormones and we can find out that you have them in your body. No matter what age you are. You can be 85 years old and still have hormones in your body. You just don't have very many of them. So what we want to do is give your body the difference. Make up for the difference. Give your body enough hormones in the form of hormone therapy to replace what you don't have, to bring you up to youthful levels just like you did when you were a kid, in the same way that we want to replace vitamins if you're deficient in a vitamin, or minerals if you're deficient in a mineral, or whatever nutrient you might be deficient in. The third reality about hormone replacement is that there is a contraindication to it. But the contraindication towards hormone replacement therapy is only two, and that is prostate cancer and breast cancer. So if you currently have prostate or breast cancer, you definitely need to talk to your doctor before you consider replacing hormones. Other than that, There are no other hard contraindications to hormone replacement therapy, and I'm talking about the one that I hear a lot, which is clotting. If you have a history of clotting, you shouldn't take hormones. This is just not true. When they're properly replaced, there is no increased risk of clotting from hormones. And all the other side effects and things that you hear about hormone replacement therapy either come from one, it's not done properly, or two, more likely, it's they're not really talking about hormones. They're talking about drugs that have been used instead of hormones. True hormone replacement is very safe, and the only hard contraindications are these ones that I just mentioned to you. Okay, what are the hormones that we're talking about? What are the hormones that are most commonly replaced? Well, first of all, there's a lot of them. Most people think when they think of hormone replacement therapy, probably just think of this one here, estrogen, or maybe testosterone. But there's a lot of hormones we're talking about. There are this category of sex hormones. Sex hormones can consist of testosterone, estrogen, and progesterone. And yes, men and women have all three of these hormones. True, women need more estrogen than testosterone, and men need testosterone and no estrogen at all, actually. And both men and women need progesterone. So that's the sex hormones. The other hormones we're talking about, incredibly important hormones, and hormones that are overlooked by the overwhelming majority of physicians today, and that's the adrenal hormones. Hydrocortisone, also known as cortisol, pregnenolone, and DHEA. Many of you may never have heard about these hormones. That's how overlooked they are, but they're incredibly important to replace, and we'll talk more about them. Number 3 would be the thyroid hormones. Pretty much everybody's heard of thyroid hormones, but what you might not realize is there's two kinds. There's T3 and there's T4. And we'll talk a little bit about that and the important difference between the two. And then we have growth hormone, and growth hormone is usually looked at in terms of two different hormones. I am not in this talk going to really talk much about growth hormone at all. But growth hormone does stimulate the liver to make two different hormones. One's called IGF-1, one's called IGF binding protein 3, or also known as IGF-BP3. And I did do a lecture on, it's called Sermorelin, the Fountain of Youth, and you can take a look at that lecture, and I'll get into detail on growth hormone therapy in that lecture, but we're not going to touch upon that today. And then the final category is melatonin. Melatonin, we're not going to touch on too much today. We're going to spend most of our time talking about the sex hormones, the adrenal hormones, and thyroid hormones. Okay. This is important. This is really critical. So the first thing that I thought was really critical for you is to understand the process of remodeling. The next thing that's really critical for you is to understand this next few slides that we're going to see, which covers an area that I dare say probably 80% of physicians don't even know this, and it's basic biochemistry. And because of the ignorance around what I'm about to show you, we have just so many people speaking about the fact that there is danger and there's some kind of problem with replacing hormones. All that is based upon the fact that a lot of people don't know the difference between hormones and drugs that have hormone-like effects. So, first of all, let me preface this and start off just by reminding you that due to the way the patent system works here in the United States, a drug company cannot get a patent on anything that naturally exists in our bodies. Okay? So, for example, a hormone or a vitamin or an enzyme, anything that's naturally in our bodies, you can't get a patent on. The only thing that you can get a patent on is something that's absolutely unique, that's never been in our bodies before. So that's what drug companies do. If you can't get a patent on a substance, there's absolutely no use from a financial perspective in doing research on it. There's certainly no use in manufacturing it and selling it because you can't make a good profit margin. But if you can get a patent on a substance, now that's something that would really appeal to the bottom line of any pharmaceutical company. So that's kind of the catch-22 we're in. We're in a system, a medical system, that points and focuses all its attention on patented medications and essentially none of its attention on natural substances like vitamins, minerals, hormones, things like that. So I want you to understand this, because when you hear what I have to say, you're probably going to ask the first question, well, why in the world does my doctor want to give me these drugs that have hormone-like effects? Why would he want to give me those drugs when he can actually give me the hormones that are naturally in my body? And the answer has nothing to do with good medicine at all. The answer has everything to do with profit. It's because natural things, hormones that are already in your body, you can't make a profit on. So the drug companies aren't interested in them. Okay, but let's go back to the slide here. The two main drugs that you will have heard about so far are Premarin and Provera. These are not hormones. You will hear doctors constantly refer to these as hormones. You will hear doctors refer to giving Premarin and giving Provera to patients as hormone replacement therapy. You will see headlines in the newspapers saying hormone replacement therapy causes such and such a disease when it's not true. So people constantly are mixing up drugs that have hormone-like effects with hormones. Premarin and Provera and other synthetic, quote, hormones are not hormones at all. They're drugs that have hormone-like effects. That's why they're a problem. In a moment, I'm going to show you exactly why that is, and you're going to see very graphically why that is. These drugs are dangerous, and they've been proven. You've seen it. You've read the headlines. They've been proven to increase risk of cancer, strokes, heart attacks, and just about any other disease you can be associated with aging. So why? Why are these drugs that have hormone-like effects so darn bad? Well, basically for two reasons. Number one, the person that's getting the drug actually needs hormones. That's why they're getting the drug. So, for example, when a woman has hot flashes, they give the drug Premarin to her to alleviate the hot flashes, which it does very well. But at the same time that she's getting this drug and she's not getting her hormones. She's still missing hormones. So one of the reasons they're dangerous is you're not actually replacing what's missing. The second reason they're dangerous is more obvious. You're taking a drug. Drugs are not natural to the human body, and they have a long list of side effects. You don't see side effects on vitamins. You don't see side effects unless you're allergic to something on foods. You don't see side effects at anything that's natural to the body. You don't see side effects on hormones. You don't see side effects on anything that's natural to the body. But you'll see a long list of side effects on things that are not natural to the body. A long list of side effects on drugs. And so there's two reasons why these drugs have been such a problem. Because one, they block what your body actually needs. And two, they have their own long list of side effects. So don't mistake all those headlines. Don't mistake the talking heads on the TV station that tell you that hormone replacement therapy has been shown to do this, this, and this, and it's dangerous and it causes cancer and blah, 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 and all these kinds of things. They're not talking about hormone replacement therapy. They're talking about replacement therapy that uses drugs that have hormone-like effects. For example, the biggest ones known are Premarin and Provera, and there's a list of other drugs. So if your doctor is giving you, quote, hormone replacement therapy, just ask the pharmacist to if in fact this is the natural hormone that is already in your body, or if this is a patented medication. If it's got a patent on it, it's not natural. Okay, next up, I want to show you why this is true. So let's just look at these top two hormones right here. This is estradiol. This is the main female hormone. Okay? This is testosterone. This is the main male hormone. Now, they call these hormones sex hormones. Why do they call them sex hormones? Well, I think some people think that the reason is because they influence your sex life. When you don't have your sex hormones, you tend not to have a sex life too. But I don't think that's the main reason we call them sex hormones. We call them sex hormones because they differentiate. When you're young and you're developing and you have estradiol, that causes you to be a woman, and when you have testosterone, it causes you to be a man. So these hormones basically determine your not only your sex life but your sexual characteristics and your actual sex. Having said that, you can think immediately of the dramatic different effect between estrogen and testosterone on the human body. Think of it. You got one hormone over here called testosterone that creates all the male characteristics. And you got another hormone over here called estradiol that creates all the female characteristics. And there's just huge differences between men and women. And these hormones are primarily responsible for that. So keep that in mind. One causes you to be a woman, the other causes you to have male characteristics. And now let's go back to the slide because I want to show you something that's really fascinating. Here's estradiol again, here's testosterone. Look at them. Don't they look almost the same? Don't they look almost identical? They almost look identical, and yet they have such a dramatically different effect on the human body. Well, that's because they're not identical. There are some differences. For example, if you look at estradiol, right over here in this position on the molecule is one oxygen atom with a hydrogen. But if you look at testosterone right over here, there's the oxygen atom, but there's no hydrogen. So one of the differences between estradiol and testosterone is a hydrogen atom. The misplacing, a difference in where a hydrogen atom is. The other difference has to do with where the double bond is. This is what you call a double bond in chemistry. So in testosterone, the double bond is on this side of the oxygen atom, and on estradiol, it's on that side of the oxygen atom. But folks, listen to this. That's the only difference between these two. Other than that, they're 100% identical except for these extremely minor changes. A hydrogen atom and a double bond placement. That is the only difference between these two molecules. That's dramatic. Slight differences in molecules create dramatically different effects. That's what I want you to remember. So as soon as you change one of these molecules in the slightest of ways, you're going to have dramatically different effects going on in the human body. Now keep that thought in mind, because the next thing I'm going to show you up here is the difference between progesterone and a drug that's commonly used to replace progesterone called Provera. So let's take another look again. Keep in mind what we just talked about. Here's progesterone. Well, actually, it looks a lot like estradiol and testosterone, doesn't it? But there are some differences. But they're very similar. In fact, progesterone looks almost identical to testosterone, except that progesterone has this configuration with oxygen up here, and testosterone has a slightly different configuration. Other than that, they're almost identical. And yet they have dramatically different effects in the body. But that's not what I wanted to focus on mostly. What I really want to focus on is Provera, also known as medroxyprogesterone. That's the generic form of it. This is not natural to your body. God never made your body to have Provera in it. This was made by a drug company somewhere. This is what your body has. Why, if your body is deficient in that, would you stick in this molecule? It's insanity, except for the fact that the only way you can get a patent is you can get a patent on this one. Can't get a patent on that one. But look at the difference between progesterone and Provera. Methyl group here, not over here. Methyl group here, not over there. Methyl group here, not over there. Acetate group here, not over there. Another methyl group and a carbon with an oxygen over here, not over there. We've got a lot of differences between Provera and progesterone. Now, if you only have slight differences between these natural molecules create dramatically different effects in the human body, what do you think all these changes are going to do to the human body? It's going to be disaster. So it's not at all surprising to me, and it shouldn't be surprising to you, that study after study shows that when you give a woman Provera, you do increase her chance of almost every disease there is. So what I just want to get this take-home message to you, when you hear that replacing hormones is unsafe, what they're really talking about is not replacing hormones with hormones. They're talking about replacing deficient hormones with drugs. In fact, when you replace deficient hormones with hormones, things that are already naturally in your body, there are no side effects, there are no dangers. In fact, as I alluded to, it's dangerous not to do it. Okay, so now let's get into some practical differences. What are the symptoms of hormone deficiency? So let's look at estrogen and progesterone. What are the kinds of things that are going to happen to you as you become deficient in estrogen and progesterone? Well, just let's look through the list. And these are not exhaustive lists. I'm just listing the main things that can happen. So insomnia, very common. Hot flashes, of course, is the one thing that almost everybody knows about. Mood disturbances can be pronounced. So can insomnia, by the way. Mood disturbances can be pronounced. They can be so pronounced that the doctor and the patient alike will be convinced that the patient is undergoing a major depression or a major anxiety episode when all they really need is some hormones. Hormones have dramatic effects on the brain. Keep that in mind. So if your brain is not getting the hormone levels it needs, you're going to see big-time mood disturbances and big-time brain fog. Now notice, what are the things that happen to people as they get older? When they hit their 7th and 8th decade, we see the incidence of depression climbing dramatically. It goes, you compare the incidence of depression in young people with the incidence of depression in the over 50, 60 crowd, it's dramatically different. What's happening with the brain? Does the brain get clearer as you get older? Not typically. Not unless you're maintaining your hormone levels. But otherwise, your brain is just not going to work as well. And that is a primary disturbance that we see with hormone deficiencies, brain fog, mood disturbances. The other thing we see very commonly is joint aches and stiffness. And of course, in women, we'll see vaginal and bladder irritation. In men, you'll also see bladder irritation. Of course, decreased sex drive, and finally, fatigue. So if you look at this little list right in here, you'll see some of the major things that happens to people as we get older. We have trouble sleeping. Brain doesn't work as well. We tend to get moody. We have no sex drive, and we tend to get tired. In many, many cases, this is 100% controlled by hormones. You replace your hormones, you don't have these problems. With testosterone, it's very similar. Testosterone being a hormone that is a male hormone, but it's also incredibly valuable for females as well. But you get the same kind of thing. Mood disturbances, joint and muscle aches, decreased stamina and strength, bladder irritation, brain fog, decreased sex drive and performance, fatigue. Now the thing about men and women is women go through these changes so dramatically that they know. They know right away, yes, this is due to my hormones being off. At least usually they do. Men, we go through the changes so slowly and so insidiously that we very often don't recognize that we're hormonally deficient. So when I ask a man, do you have any of these problems? Do you have muscle aches? Is your stamina down? Is your sex drive down? If I ask a man that question, he'll almost always say, no, I'm okay. But if I put the question this way, I say, compared to the way you were when you were 40 years old, is there any decrease in your sex drive, any decrease in your stamina, any decrease in your energy, any decrease in your mood? If I put the question in that way, almost always the man will say, well, yeah, I definitely see it if you're going to put the question in that way. So men, I want you to think that way. Compare yourself now, at this age, to what you were like when you were around 40 years old. If there's a decrease in any of these things we're talking about, in all likelihood, you're hormonally deficient, and you need to replace those deficient hormones. Okay, the other hormones I wanted to mention also are the adrenal hormones. We see this all the time. I would have to tell you that 85 to 90% of people that walk in my clinic have a deficiency of adrenal hormones. I have another lecture all by itself on adrenal hormones because this topic is so important. So make sure you take a look at that lecture as well. But it is the primary cause of fatigue and allergies that we see, in medical practice today. That fatigue with adrenal hormones can be profound, and one way to recognize it is particularly bad in the afternoon. So that if you think to yourself, I'm pretty good in the morning, but in the afternoon I fall apart, or in the afternoon I have to reach for the coffee, my fatigue really comes on strong at that time of day, you're adrenally depleted. You need adrenal hormones. The other things that are commonly associated with this is insomnia, decreased immune function. In fact, a decrease in adrenal hormones is one of the major factors in why people develop that wide category of diseases called autoimmune diseases. Allergies, almost always associated with decrease in adrenal hormones, brain fog, headaches, low blood sugar, sweet craving, all of these things. If you see you have those symptoms, to some degree, you're deficient on your adrenal hormones. And then again, I want to focus again on thyroid hormones. Thyroid hormones, if you go and you Google thyroid hormone deficiency symptoms, you're going to get a list of symptoms that basically include anything that can go wrong with you. That is because thyroid hormones, incidentally, this is also true for adrenal hormones, what I'm about to tell you, but thyroid hormones, more so than any other hormone, directly influence how each and every cell in your body works. Thyroid hormones are what turn your cells on to work. That includes your brain cell, your heart cell, eyeball cell, whatever cell you want to talk about. Thyroid hormones turn them on to work. And they're kind of like the accelerator pedal on your car. If you can have the world's greatest car, but if you don't push on that accelerator pedal, it's not going anywhere, and it might as well be a clunker. And that's the same with thyroid. So if you don't have enough thyroid hormone, if you're just a little deficient on that, you could have perfectly good brain cells, perfectly good heart cells, and so forth. They just won't work up to par. So if you look at the list again, it includes fatigue, weight gain. Big reason that people gain weight as they get older has to do with deficiency of thyroid hormones. In younger women, you can have menstrual disturbances, major cause for chronic headaches, major cause for bowel disturbances, and like I said, basically anything that happens to you as you get older, you can probably think of thyroid hormones as playing a major role in all of that. And then lastly, I'm just in passing going to mention melatonin. Melatonin is an extremely important hormone. Many people think of melatonin as being a remedy for sleeplessness, which of course it is, because when you're deficient in melatonin, melatonin is a sleep inducer to the brain, and you can have marked insomnia with melatonin deficiency. However, also understand that melatonin is incredibly important for your immune system. And deficiencies in melatonin put you at significant risk for cancers across the board, which is one of the reasons why as we get older, the incidence of cancer gets dramatically high. It's because our melatonin levels go down. And then finally, just a mention about growth hormones. Again, I did a lecture on this called Sermorelin, the Fountain of Youth. You can learn more about growth hormones in that lecture. But growth hormones stimulate collagen in the body. Collagen is what holds your body together. It holds your muscles together, it holds your organs together, it holds your skin together. Collagen is incredibly important. And the way we make collagen is directly dependent on growth hormone. Got a lot of growth hormone? Make a lot of collagen. If you damage a tissue, you sprain an ankle, you break a bone, you need to have a lot of growth hormone to make the collagen to cause that area to heal again, which is one of the major reasons why people, as they get older and their growth hormone levels go down, they don't heal nearly as well as they did when they were younger with the high growth hormone levels. So that's kind of all I wanted to say about growth hormone. You have decreased collagen when growth hormone is deficient, and which leads to decreased lean body mass, decreased skin integrity, organ dysfunction, weakness, and frailty. And so growth hormone is very important. So what are the diseases of hormone deficiency? You know, we talked a little bit about keeping young, keeping healthy through the process of remodeling. We've talked about symptoms that you get from hormone deficiencies. So we know that when your body's deficient on hormones, the quality of your life is going to be down. You're going to have symptoms bother you, which normally you wouldn't have, anywhere from aches and pains to fatigue to insomnia to headaches, all kinds of stuff like that. We also know that in the absence of hormones, because you won't have that process of remodeling going on, you're going to age faster. Your body's going to break down. You're going to get weak and frail more quickly and to a greater degree if you don't replace those hormones. But I want you to understand that all the diseases that we get, or we get have an increased risk to as we get older, all of them are tied into hormone deficiencies. So much so that many of these diseases can be treated by replacing growth hormone. If you have a case, for example, of arthritis, you can cure that case of arthritis, in many cases, by just giving hormone replacements, whatever's deficient. Diabetes is another one. Heart failure is another one. Many of these cases can be absolutely reversed medically just by replacing hormones. So think of that. And just think that when you don't replace these hormones as you're getting older, you're just making yourself more susceptible to all these diseases. So let's look at them. All this stuff that I'm telling you about is in the literature. It's well established in the literature. Heart disease. Major cause of heart disease is deficiency of the sex hormones. Strokes. Major cause of strokes, deficiency of hormones. Alzheimer's and dementia. They're two different kinds of conditions, but they both lead to the same sort of symptoms. Both of these can be dramatically, the risk for these can be dramatically reduced with proper hormone replacement therapy. In fact, Alzheimer's alone, studies have shown that you can cut the incidence of Alzheimer's in half. Another way of putting this is that 50% of people with Alzheimer's disease don't need to be having it if they would have replaced their hormones as they were getting older. Dementia, many cases of dementia caused by deficiency of hormones. Diabetes, osteoporosis, depression, major depressions can be reversed with hormone therapy. Osteoporosis is not a disease where you have a deficiency of any of these drugs the pharmacies want to sell you. Fosamax or Actonel. Osteoporosis is a deficiency of hormones. Replace the hormones and you won't get it. Arthritis is not always, but often a deficiency caused by deficiency of hormones. I mentioned autoimmune diseases. All the autoimmune diseases, from lupus to rheumatoid arthritis to scleroderma to I think I mentioned multiple sclerosis. That's one I forgot. All of these autoimmune diseases dramatically increase in the presence of hormone deficiencies. So if I have a patient that has those diseases, one of the first things I'm going to do is replace their hormones. They're automatically going to do much better, and in many cases literally become cured simply by replacing hormones. Cancer. The incidence of cancer dramatically goes up as hormone levels go down. And there is a cause and effect relationship there. Hormones protect your body from getting cancer. So as they become deficient, your body's more likely to develop many cancers. Immune deficiencies, the older you get, the more likely you're going to die of pneumonia and other infectious diseases. So much of that could be stopped with simply hormone replacement. It's properly done. Obesity, the major cause of obesity in people who get older is hormone deficiencies. And finally, a lot of simple things like incontinence, things that go wrong with the bladder and so forth and so on. There's a lot of diseases there that have as a major factor, and sometimes the major factor, a deficiency in hormones. Keep that in mind. The next time you're thinking, well, I'm getting a little bit older, maybe I should have my hormone levels checked, or maybe I should think about some hormone replacement now. Okay, so that's the big pitch on why this is so important and why you should think about it. So now let's talk a little bit about how it's actually done, because there's a little controversy around that as well. How are hormone deficiencies diagnosed? Well, the first thing I want to underscore with you is forget lab tests when it comes to diagnosis. Everybody's into lab tests. Everybody says, I'll go get a lab test if the lab test is going to tell me if I'm deficient or not. Forget that. It won't happen in most cases. Probably in 10% of cases, you can diagnose a hormone deficiency with a lab test. But the other 90% you're going to miss. Why is that? It's because there's such a huge range in hormones. Let's take, for example, testosterone. For men, the range of testosterone on one end is 200. On the other end is about 900 to 1,000, depending on what lab you go. There's a factor of 5 difference in there. So if you're a guy, for example, and you go and you have your hormone level checked and it's 400, well, you're right in the middle of the range. But maybe 10 years ago it was 800. If it was 10 years ago 800 and now you're 400, you have half as much as you used to have. You're definitely, markedly hormonally deficient, and yet you're in range. This is true for essentially every hormone there is. The ranges are so wide that you can't use them to diagnose. Now, it's true, if I check a hormone level on a man and his testosterone level is 800 or 900, I'm definitely going to start thinking the odds are pretty good he doesn't need any hormones. But other than that, if he's down somewhere around the median or anywhere else in the range, I'm not going to go on that at all. So never, ever, ever diagnose your hormonal deficiency by lab tests alone. Don't do it. It won't work. You're going to miss most hormone deficiencies. How do you diagnose hormone deficiencies? You suspect them. That's the first stage. So as you folks are listening to this lecture, many of you are starting to suspect that you have hormone deficiencies. Why? Because you know what? You're older. You know, I'm 63. I guarantee I have hormone deficiencies. And I take a lot of hormones, as you might have guessed, to replace those deficiencies. But starting around the age of 45 to 50, your body starts to decrease in its manufacture of hormones. So if you're over the age of 50, certainly if you're over the age of 55, 60, you're automatically suspect to have many of these hormonal deficiencies. So your age is an automatic suspicion. Next is symptoms. So we talked about symptoms. I don't care what the lab test shows. If you are old enough and you have the symptoms for a hormone deficiency, whether it's hot flashes or depression or decreased stamina or decreased energy or decreased sex drive or your brain's not working quite as well or you don't sleep quite as well or whatever the symptoms are, if you're old enough and you have any of those symptoms, that's a pretty good idea that you probably do have that hormone deficiency. So that's how you're going to diagnose hormone deficiencies, based upon suspicion with your age and symptoms. Now, yeah, lab tests do play in, kind of like what I was alluding to, in as much as if I've got the age is right and the symptoms are there, and I do the lab tests, if the lab tests, are very high on the spectrum, I would say, well, it's probably not deficient in that hormone. Let's go look for one where it's not high on. So lab tests can be helpful, but never ever diagnose based upon that. Diagnose upon your suspicion on age and symptoms, and then do what's called a clinical trial. So what a clinical trial is, just a fancy word for give the patient the hormone and see what happens. So if I have a man coming to see me, and let's say he's 55 years old, and let's say he says, you know what, I'm just moody. My wife says I'm depressed. My coworker said I'm just not the same guy I used to be. I get grumpy, or I've lost my enthusiasm for my work, or I'm going through middle-age crisis, or whatever the problem he has. Or let's say he says, I'm just kind of weak, or the doctor just told me I had diabetes, or something like that. I'm going to automatically suspect that this man has a hormone deficiency. I'll get a lab test. Unless the lab test shows me that he's way on the high end, I'm going to give him a clinical trial, which means I'm going to give him the hormone. Now, I'm going to give him the hormone for 1, 2, 3, 4 months. Whatever it takes in order for me to find out if that hormone alleviated his symptoms. Because if he's got depression or weakness or insomnia, and I give him the hormone, and those symptoms go away, that confirms the diagnosis for me. And now I know. And that's called a clinical trial. So that's how you diagnose a hormone deficiency. Based upon age and symptoms, you come up with a suspicion, and then you verify that suspicion by giving the patient the hormone and determining whether or not the symptoms went away from the hormone therapy. If they did, you have just made your diagnosis. And folks, I want to tell you, 90% of the time that goes on, the lab tests are all in the normal range. So don't rely on lab tests. Look at your symptoms, look at your age, and if there's any chance you have a hormone deficiency, take the hormone. They're safe. Even if you don't need them, you take them for a short course of time, and they're properly monitored through lab tests, you're not going to hurt yourself anyway. They're natural substances in your body anyway. So the chances of you hurting yourself are extremely slim, probably none if they're done properly. So let's talk a little bit about how you actually treat them. And I talked about done properly. How are hormone deficiencies treated? Okay, we just talked about you suspect it. Now you're going to give a clinical trial. And I basically have this 4 golden rules that I follow. And every physician ought to follow these 4 golden rules. Number 1, if you suspect a hormone deficiency, treat it with a hormone. Don't treat it with a drug that has hormone-like effects. Treat it with a real hormone. That means it's not patented. You get it from a compounding pharmacy company, and it's the actual same thing that's really in your body. Number 2, replace all the deficiencies. In other words, if you're deficient in estrogen, testosterone, thyroid hormone, or say T3, and hydrocortisone, and you just replace hydrocortisone, you're missing the boat. Hormones work together. They orchestrate together. Hydrocortisone won't work in the absence of other hormones, and the other hormones won't work in the absence of hydrocortisone, and so forth and so on. They all need each other. They all work together to establish that whole process of remodeling we're talking about. So if you're deficient in 5 hormones, you take 5 hormones. If you're deficient in 2, you take 2. So that's the next thing. So first of all, only use hormones. Second of all, whatever you're deficient in, replace the whole darn thing. And it's really easy to do that, by the way. Doesn't mean you got to take 100 different pills. It's very easy to combine them all and actually take one pill or take one cream or so. Third thing, this is sort of obvious, individualize the dose. Don't have a one-dose-fits-all type of mentality. We're all different. Heck, I've even run into ladies who are 60 years old that don't even need any estrogen. And of course, I've run into women that are 35 years old that need a ton of estrogen. So everybody's different. So that's where the lab test, by the way, can be handy. And also, that's where your symptoms can be handy, because basically you're going to take enough of the hormone to make the symptom go away. So don't have a one dose fits all type of mentality. Individualize all the doses, and then finally establish a balance. Balance is critical for hormone replacement therapy. So if I give estrogen and I give progesterone, I want to make sure that the balance and the ratio of the progesterone to the estrogen is proper. If I'm giving testosterone to men, it's very critical in doing that to make sure that the ratio of estrogen in men to their testosterone level is optimal. So those are the 4 golden rules. So just to repeat, number 1, use hormones. Don't use drugs. Use actual hormones, things that are already in your body. 2, replace all the deficiencies. If you got hot flashes and you know those hot flashes will go away with estrogen, don't just look at estrogen. Look at everything, because then it'll all work together. Incidentally, too many women and too many men are getting overdosed with these hormones because their doctors are not giving them all the hormones they need. Let me give you an example. Like estradiol is a primary female hormone. And if you don't give all the other hormones that that patient needs, you're probably going to have to give 2 or 3 times more estradiol to get the desired effect. But if you balance all the hormones, get them all in there, you can give lower doses of each hormone, which is much more appropriate, much more natural. And 3, individualize the doses, and then 4, get that proper balance we talked about. So those are the 4 golden rules of hormone replacement therapy. Your doctor needs to be following each one of those rules. The other thing I want to mention to you is on the sex hormones, creams versus pills. When I first started off doing this, something like 19, 20 years ago, I used pills a lot. Why? Because the creams didn't work. I couldn't get any effect from them. However, the compounding pharmacists are just superb at making creams now, and creams are the way to go. Every now and then we will run into a woman that the creams don't work well in, but that's so rare. So definitely your sex hormones need to be taken in the form of creams. Creams bypass the liver. They don't have the first pass through to the liver like pills do. They're much healthier for you, and they're much natural. They're also cheaper, and they're a heck of a lot easier to do, because you can take a cream and then the person can learn to self-dose themselves. A pill, you're kind of stuck with a pill. You might be able to break it in half, but you're basically stuck with a pill. With the cream, you can take more cream, you can take less cream. So you can establish the dose very accurately with the cream. And so definitely use creams for your sex hormones. Adrenal hormones, we give those in terms of creams or capsules. I do equally well with either one. I think one thing I want to mention, timing is critical with adrenal hormones. So when you go to the lecture that I've done on adrenal hormones, we'll talk a lot about timing. But when you take these hormones, it's very important to take them spaced throughout the day in a very timed kind of fashion. Thyroid hormones. I guess the big thing to remember here is that the major hormone, thyroid hormone, that most doctors give is T4. T4 is also known as synthroid, levothyroxine, Lavoxyl. Those are the main forms of T4. T4 is inactive, doesn't do anything. In your body, it will get converted to T3, but a lot of people's bodies do not do that well. So if your doctor's giving you T4 and you're not getting a good response out of it, it's probably because you don't convert T4 to T3 very well. This is extremely common. So in my practice, I never start somebody on just T4. I always start them on a mixture of T4 and T3, roughly about a 30% mixture. So there's about 1 part in 3 is T3 and 2 parts in 3 are T4. But sometimes we have to come back. We have to really alter that combination quite a bit. So keep that in mind. The ratio from T3 to T4 is critical in order to get the proper result for thyroid hormones. The last thing I want to mention about thyroid is watch out for reverse T3. Many patients who are getting T4 or synthroid as their thyroid hormone don't know that their body is converting that to a substance called reverse T3. Reverse T3 absolutely undoes what thyroid hormone is supposed to do for. And almost no doctors are checking for reverse T3. So if you're on synthroid and your doctor hasn't checked you for reverse T3, you don't know if you have this problem. I will tell you that in my experience, 60 to 80% of patients that are on synthroid have unacceptably high levels of reverse T3. So remember that you have that checked. And then the last one on the slide here is growth hormone and melatonin. But the growth hormone comes as an injection. And again, I refer you to the lecture I did on that. And melatonin is very simple. It's just a capsule you take at bedtime. Well, we're getting ready to wrap up here pretty soon. I kind of alluded to this. Once you've started your clinical trial, how do you do your follow-up testing? Well, certainly you look at symptoms. Certainly you look at hormone levels in lab tests. And then finally, you look at metabolic markers. These are probably the most important. And so, again, what do hormones do? They cause your body to remodel. They cause your body to be younger, to be stronger. So what should you recheck? As you're checking the effect of the hormone, you should check your body, see if it's stronger, see if it's healthier, see if it's younger. And that's where these metabolic type markers come into play. So that we look at your body mass analysis. We want to see less body fat. We want to see more lean body mass, basically muscle and bone. We check your mitochondrial function using bioenergy testing, which is the premier mitochondrial functional analysis. You can learn more about that, by the way, on my website. And also it's in all my books, by the way. I discuss this as incredibly important tests for determining hormones levels. Of course, bone density, that's one of the easy tests that we can do to determine whether you're getting adequate amount of hormones. If your bone density is low, you're hormonally deficient. That's that. Once you get your hormones replaced properly, you check your bone density the following year, it'll actually be increased, and then you'll know you're getting enough. If it's decreased a year later, you're not getting enough. So it's a very good marker for hormone therapies. And then finally, there's a urine test called N-telepeptide, which is something that your doctor can use to follow to determine if you're getting adequate amount of hormones. If you aren't, the N-telepeptide is going to be elevated. So you can use that. In summary, in hormone replacement therapy, it improves the quality of your life. It keeps your body and your mind functioning better and longer. Proper hormone replacement therapy dramatically decreases the incidence of all kinds of diseases, and in many cases reverses diseases. If you have diabetes or heart disease, a lot of times you can just reverse that by replacing your hormones. And they're completely 100% safe when they're properly prescribed. So I hope you've enjoyed this talk, and I hope you do some more research on this and learn more about hormones. In all of my books, I've got a whole chapter on hormone replacement therapy, so you can get some of the details, and also you can get all the medical literature references. Until next time, be healthy, stay well, and replace those sagging hormones, okay?